I'll be your nurse today.
Hi, Shannon.
Hi, nice to meet you. So what seems to be the problem?
Okay, well, lately I've just been having a problem. I've been a lot more clumsy lately, and I've been, kind of walking into things, dropping things, so it's just weird.
Yeah, that does seem odd. And when did this begin?
A couple weeks ago, it started to kind of get worse and worse, and now it's I've noticed it's become a problem,
And then do you notice it's worse maybe at night or in the day?
Kind of at night, it gets a little bit worse, I can't, other than that, that's it.
Okay, and it's just walking into things. Do you see that it's anything specific?
My eyesight's kind of blurry, but I don't know if that's really the problem, or if it's just because I'm just clumsy, I'm just not as coordinated anymore.
Okay. And then you said that this is usually more at night. Would you say this is a continuous daily thing, or it goes by weeks?
It's pretty much every day now. It started out not so bad, but now that it's kind of developing more, I guess, it's every night.
All right. Do you have any idea of what's going on?
Yeah, I have no idea.
Okay. Then have you had any recent surgeries, shots?
No.
Any recent injuries, substantial?
No, not that I can remember.
Okay. All right, so then let's begin this assessment. Okay, so let's look first at your cranial nerve 1, which is your olfactory nerve. So I have 2 different scents for you. Okay, so I'm going to hide these 2 scents from you, and I'm going to ask you to plug one nose, and then close your eyes, and I'm going to hold this scent on your nose and tell me what you think it is.
Great.
Yes, correct. Okay, now undo the other one. And now, close your eyes again. All right, and that's what this smell is.
Strawberry?
Yeah, okay, great. So your olfactory nerve seems to be fine. Now for your optic nerve, if you could stand up, and if you could face me directly, and I'm going to tell me when you see, out of your peripheral vision, just looking straight at me, when you see, and just close one eye, good, and then, okay, and then tell me when you see my hand.
Okay.
Ready?
I see it now.
Okay. Okay. All right, and now for the other eye. All right, tell me when you see my hand.
Okay, I see it now.
Okay.
Yeah.
Okay. All right, and now you can sit down. I'm going to check your eyes, so your oculomotor. So let me use my light, and I'm going to shine in one eye and see if both the pupils do the same thing. Okay, so I'm going to come up to the side of you, so just look right over here in this corner.
Okay.
And just try to relax. Okay, good. Both eyes constricted at the same time. Okay, so that eye looks good. Now just look straight here. I'm going to check the other one. Alright, good. Now I'm going to check your corneal reflex. So I'm just going to check for the reflection on both eyes. So just look straight ahead again. Okay, you have equal reflections. That's great. And now I'm going to see I'm going to ask you to look straight ahead of me. And now, when I shine the light, or I don't even need to shine the light, I'm just going to go follow this here. So follow this, adjust your eyes. Alright, great. Alright, that seems perfect. And now for your trigeminal nerve, I'm going to ask you to open your mouth, and now close your mouth. And now grind your teeth. Alright, do you feel any pain there or anything? Alright, you're able to do that. Okay, so now I'm going to take this piece of fabric and just tell me where you feel it on your face.
Okay. On my cheek.
Okay.
My nose.
Okay.
My other cheek.
Okay.
My forehead.
Alright.
My chin.
Alright, great. Now for your facial nerve, I'm going to ask you to look at me and smile. Alright, now puff out your cheeks. Okay, and see if you can hold against resistance. Alright, perfect. Alright, so now I'm going to check your acoustic nerve. So I'm going to do the whisper test, the Weber test, and the Rhine test. So for the whisper test, I'm going to stand about 2 feet from, or a couple inches from your ear, and I'm going to say a 2-syllable word,
Okay.
and you have to tell me what you hear, okay? And plug your opposite ear. Okay.
Baseball.
Good. All right, and now sit forward so I can do the other one. So plug your opposite ear.
Springtime.
Good. All right, great. So now I'm going to do the Weber's test.
Okay.
All right, so for the Weber's test, which one is that? Wait, for that, this one. Okay. Okay, so now I'm going to do the Weber's test.
Okay.
For the Weber's test, I'm going to hit my instrument here and put it on top of your head. You have to tell me if you can hear equally with both of you. So sit forward. I'll come up behind you here. All right, so just tell me if you can hear equally.
Yeah.
All right, great. And now I'm going to check for the rhyme test. I'm going to first hit my instrument and hold it up against your bone here, and then you can tell me when you stop hearing it here, and then I'm going to hold it up against your ear and tell me when you stop hearing it here.
Okay.
And it should be you should be able to hear it 2 times the amount when I'm holding it just up against your ear.
Okay.
And I'm going to watch my clock while I'm doing the time here. All right.
Okay.
All right, great. You were actually a little bit above 2 times, which is great. It seems like your hearing seems to be in very good shape. Now I'm going to check your other ear to see how your other hearing is. So I did this one, so let me do the other one here.
Okay.
All right. So tell me when you stop hearing.
Okay, now.
Okay.
And now.
All right, great. That was great. All right. So for your next nerve, we're going to do your glossopharyngeal and vagus nerve. So I'm just going to ask you to open your mouth and stick out your tongue and say ah. All right, great. So the fact that you can move your tongue out and the fact that your uvula is moving back and forth means that those nerves are intact. So for your spinal accessory nerves, okay, so for your spinal accessory nerves, I'm going to ask you to stand up, and I'm going to ask you to shrug your shoulders against resistance.
Okay.
All right, great. So now I'm going to ask you to turn your head against resistance. All right, great. So now I'm going to check your speech. So if you can repeat after me, say light, tight, dynamite.
Light, tight, dynamite.
All right, very good. Maybe just say it a few more times just so I can answer.
Light, tight, dynamite. Light, tight, dynamite.
All right, very good. Okay, so for your cerebral function, I'm going to ask you to walk,
Okay.
and you're going to walk with your heel to toe, heel to toe.
Okay.
So maybe if you walk just a little bit forward here. Good. All right, very good. You can come back. And now I'm going to ask you to just stand straight with me with your feet together, arms at your sides, and close your eyes, and I'm going to ask you to stand up for 20 seconds while I time it and make sure that you can stay balanced. All right, halfway there. All right, great. Good 20 seconds. And all right, so that seems to be good. So now I'm going to check your kinesthesia. So if you can just sit down for a second and just hold out your hand. I'm going to ask you to close your eyes, and I'm going to move your finger in a certain direction. You just have to tell me which way I'm moving it. Okay?
Right. Left. Up.
All right, great. Okay, so for stereogenosis, I'm going to ask you to close your eyes and identify something in your hand, okay? So just stay there for a second. Now close your eyes while I come with you with the object. Okay, so hold out your hand. And can you identify this? Yes, correct. Okay. And now I'm going to ask you to hold out your hand. I'm going to write a letter in your hand, and you can tell me if you can identify it. Okay? So close your eyes.
B?
Yes, very good. All right, so now I'm going to ask you to sit on this chair here and lift up your right pant leg first. All right, your left will be fine. Get this table out of the way. And I'm going to check for your quadricep reflex. So I'm going to support your leg. And I'm going to go into the groove here. Good. All right, let's check your other one. I'll support your leg. Good. You have good reflexes. Okay. And now for your Babinski reflexes, I'm just going to take your foot here, and I'm going to put my finger across the arch of it. All right, and your toes didn't fan out, so that's a good sign. Check your other one. All right, good. Your toes didn't fan out. Okay. So we've gone through all of the steps here. I really don't know what's wrong with you because you passed everything. So maybe you can just check better reading glasses.
Yeah, probably.
Or just, maybe still make an eye doctor's appointment.
Okay.
But it was very nice.
All right, thank you for your help.
No problem. Bye.